Hello and welcome. Today we're diving into a condition that affects many women: bladder prolapse, also known as cystocele. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. This condition, while potentially uncomfortable, is often manageable with the right care and understanding. So, what causes this to happen? Bladder prolapse occurs when the supportive tissues and muscles that hold the bladder in place weaken. This can be due to several factors, including childbirth, especially multiple vaginal deliveries or large babies. Other potential causes include chronic coughing, straining during bowel movements due to constipation, obesity, menopause, and the associated decrease in estrogen, heavy lifting, and even genetics. A family history of prolapse can increase your risk. In rare cases, prior pelvic surgery can also contribute. Let's break down the pathophysiology. Imagine your bladder as a water balloon sitting supported by a hammock of muscles and ligaments. When these supporting structures weaken or stretch, the bladder can begin to sag or drop down into the vagina. This descent puts pressure on the vaginal wall, causing it to bulge. This bulging can then lead to a variety of symptoms, as the bladder is no longer in its optimal position for emptying and proper function. The severity of the prolapse depends on the extent of the weakening of the supporting tissues. Bladder prolapse is a fairly common condition, particularly among older women and those who have given birth vaginally. While exact numbers are difficult to pinpoint due to varying levels of severity and reporting, it's estimated that a significant percentage of women experience some degree of pelvic organ prolapse, which includes bladder prolapse. Risk increases with age, number of vaginal deliveries, and factors like obesity and chronic coughing. What are the telltale signs? Many women with mild bladder prolapse may not experience any symptoms at all. However, as the prolapse progresses, symptoms can become more noticeable. These may include a feeling of pressure or fullness in the pelvis or vagina, a bulge protruding from the vagina, difficulty starting urination or emptying the bladder completely, frequent urinary tract infections, leaking urine, stress incontinence especially when coughing, sneezing, or laughing, and pain or discomfort during intercourse. Some women also experience a feeling of needing to urinate frequently or urgently. Diagnosing bladder prolapse typically involves a pelvic exam by a doctor. During this exam, the doctor will assess the position of the bladder and vaginal wall, both at rest and when you strain, such as by bearing down. They may ask you to cough to check for urine leakage. Other tests may include a bladder function test, urodynamic testing to evaluate how well your bladder stores and releases urine, or an ultrasound or MRI to get a more detailed image of your pelvic organs. Bladder prolapse is often classified into grades, ranging from 0 to 4, based on the extent of the prolapse. Grade 0 indicates no prolapse, while Grade 1 means the bladder has descended slightly into the vagina. Grade 2 involves the bladder reaching the opening of the vagina, and Grade 3 means the bladder protrudes outside of the vagina. Grade 4 represents a complete prolapse, where the bladder is entirely outside the vagina. Treatment for bladder prolapse depends on the severity of the prolapse and the individual's symptoms. For mild cases, lifestyle changes such as weight loss, avoiding heavy lifting, and treating chronic cough may be recommended. Pelvic floor exercises, also known as Kegel exercises, can help strengthen the supporting muscles. A pessary, a removable device inserted into the vagina to support the bladder, can also be a helpful option. In more severe cases, surgery may be necessary to repair the weakened tissues and reposition the bladder. Surgical options include vaginal repair and abdominal repair, often using mesh to provide additional support. While not always preventable, you can take steps to reduce your risk of bladder prolapse. Maintain a healthy weight, avoid straining during bowel movements by eating a fiber-rich diet and staying hydrated, practice proper lifting techniques, control chronic coughing, and perform regular Kegel exercises. If you are pregnant or have recently given birth, discuss pelvic floor exercises with your doctor or physical therapist. The prognosis for bladder prolapse is generally good, especially with appropriate treatment. Most women experience significant improvement in their symptoms with either conservative management or surgery. Recurrence is possible, but it can often be managed with further treatment. Recent research is focusing on improving surgical techniques, developing better materials for mesh implants, and exploring the role of regenerative medicine in strengthening pelvic floor tissues. These advancements promise to further improve the long-term outcomes for women with bladder prolapse.